What is Ebola? It's time we talk about Ebola. It's one of the deadliest diseases humanity faces. The second deadliest, which making a debut in West Africa. Plus, for the first time, two US citizens with the disease have been flown home for treatment. But don't bar the doors and windows, or get yourself walked up into some kind of 2006 bird flu hysteria because we've met Ebola before and we're learning more about it than ever. What they're referring to, Ebola that we know is the most dangerous species known as Zaire Ebola Virus or Zebov, named after the Central African country where it was first discovered in 1976 along the banks of the Ebola River. It's in the news because it has infected more people this year than it has any other year since that first outbreak. So far in 2014, it has infected 1,323 people and 729 have died. Moreover, the virus has moved into some of Midwest Africa's major population centers. According to the World Health Organization, Zebov has an average fatality rate of 83%, but in some outbreaks it has killed more than 90% of the people it has infected. The most common effect is hemorrhagic fever, which means one of its most prominent symptoms is heavy bleeding either internally or externally. Zebov also targets the entire circulatory system, causing blood vessels to fail, blood pressure to drop, and eventually all of the major organs to shut down. But let's check our head for a minute. For one thing, Ebola is contagious, but it's not an easily transmitted like the flu. It's not an airborne disease. It's only contagious by infected people who are exhibiting symptoms at the time. And even then, it can only pass through close contact with bodily fluids. Being in the same place as an Ebola victim doesn't mean you've automatically been exposed to the virus. And in another little glimmer of hope, it turns out that some people have developed a natural immunity to Ebola. A study in 2010 found that more than 15% of people in the West African country of Gabon carry antibodies for the Zebov virus, even though there is no record of an Ebola outbreak there. Researchers think that those people were exposed to the virus over decades, probably through fruit that had been contaminated by bats, original carriers. But instead of getting sick, these people just developed natural defenses. We are not sure why, but as you might imagine, there's a lot of scientific interest in the people of Gabon right now, and of course, there's no vaccine for Ebola. But many prototypes are being developed.
The Democratic Republic of the Congo revealed two new treatments that can cure the disease. But in reality, the treatment is really scary how many still die with the treatment. The standard treatment is a drug called Zmapp, but it only brings the average mortality rate down to 49%. On November of 2018, researchers started a clinical trial to test these two drugs. One was an antiviral compound called Remdesivir, which is designed to gum up one of the main proteins the virus needs to replicate. The other one attacks the virus with antibodies, proteins made by the immune system which grab onto potential pathogens so they can be destroyed. Antibodies can be very effective treatment if you can get them to stick. But the trouble with Ebola is that it can change the shape and mask itself from the immune system. So it's been hard to find an antibody that always works. So, one biotech company used special animal models to develop three different antibodies, which they then combined to make EB3 or just EB3. Other researchers looked for solution in living people. They managed to clone an antibody from someone who survived an Ebola outbreak in the 90s and called that MAB114. The trial compared those three new treatments to Zmapp in nearly 700 patients over the past 9 or so months. Unfortunately, the antiviral didn't do much, but the antibodies were amazing. A single dose of the lone antibody brought mortality rate down to 34%, and one dose of the EB3 dropped them to 29%. But an even bigger win came for patients who were treated with one of these within 3 days of getting sick. Between 89 until 94% of them survived. That's so effective that the researchers decided to call for the trial right there so they could give everyone the potential cure. Now, Dr. will start a new trial with just EB3 and MAB114 to see how they compare. and both drugs will be made available to people who aren't part of the research.